From KETK, you're watching East Texas Live. Welcome back to East Texas Live on KETK. Today we are at Heaton Eye Associates. I'm with Dr. Todd Nickel, and he's going to give us some important information about cataracts. Good morning, Dr. Nickel.
Good morning.
It's good to see you
well,
again.
Thank you. It's good to see you.
What are signs of cataract that people need to be aware of?
So with a cataract, it's all about the lens in the eye. So the natural lens, the crystalline lens in the eye, over the years, most notably when we hit 40, starts to get stiff. The older we get, the stiffer that lens gets. In our 50s and 60s, the lens, in addition to just getting stiff, starts to become cloudy. When it becomes a little cloudy, nighttime vision starts to take a hit. You can have glare, halos around lights at night. Sometimes in dim rooms, you don't see as well as you should, and you have difficulty with low lighting conditions. Those are some of the most common signs with cataracts. If cataracts have gone further than that and you're in your 60s or 70s or 80s, then sometimes it's fine reading or even seeing street signs or seeing your television at home at night with your best glasses or contact lenses on. Those are all the signs, some of the signs that cataracts can start to cause in the human eye.
Okay, and so surgery is an option for cataracts?
It's
Yes.
a great option. And so cataract surgery is a great option. And so when a patient starts to experience these symptoms, where they start to have changes in their activities of daily life, glare at night, difficulty in dim lighting situations, then they become a really good candidate for cataract surgery if the rest of the eye is very healthy. We can evaluate that at Heaton Eye Associates, where we look at the rest of the whole eye, discuss with patients, and then we can discuss cataract surgery, which is a pretty easy surgery for patients to go through, very effective, and can meet the goals and the needs of the patient to restore their vision and to give them a better, high-quality vision than they've had in a very long time.
Okay, tell me about lens options during surgery.
So this is one of the most exciting things that I do, or that we do here at Heaton Eye Associates, is we get to help a patient choose which lens option, which lens they're best for when they have cataract surgery. So we have multiple options at Heaton Eye Associates. There's a basic standard cataract surgery lens, and every time we remove a lens, the cataract, we replace it with a lens implant. There's a second option where we can correct astigmatism. When we correct astigmatism, we can restore distance vision or near vision if a patient chooses, or blended vision where there's an eye for distance and an eye for near, which works really well in some patients. Option 3, which is another elevated choice, which is where we use a premium lens, and premium lenses can restore to the patient distance, near, intermediate, and near vision, all without spectacles or reading glasses afterwards. And we now have another choice, and this is a pretty exciting piece of technology that we're now able to implant, and it's a lens by RxSight called the light adjustable lens. We were the first in East Texas to implant the light adjustable lens, and we were in a nationwide study. And the light adjustable lens is an implant that you go through the same process as any other cataract surgery or cataract surgery lens. Once this lens has been implanted in the patient's eye, and then the second eye is performed, then this patient gets to partner with their surgeon in the weeks after for some short treatments on their eye, painless 60 to 90-second treatments, where a light delivery device is changing the shape of the lens to customize the vision to create great distance, intermediate and near vision, all according to the patient's lifestyle and desired outcomes.
Wow. Do you have a sign-up sheet?
Yeah, we do.
I need to make my appointment immediately. So how does a patient know which lens to choose?
That's a great question. And when a patient comes to the Heaton Eye Associates in Athens or Longview or Tyler, we spend a fair amount of time with our highly trained technicians taking the patient through different testing the shape of their eye, testing the health of their retina and their optic nerve. But then in the examination with the doctor, with the surgeon and the patient together come up with a decision, and based on the patient's lifestyle and side effects of different potential lenses, we try to help the patient make the best decision what's best for them. So if a patient just comes in and they just need or have to be spectacle free, we have that lens for them. If they don't mind wearing glasses, there's of course choices for them. But it's a great discussion between the surgeon and the patient to come up with the best option for them based on the testing that we've done, find out what they're eligible for and what they would be a good candidate for. And we try to reflect that to the patient as clearly and as honestly as we can so we can help them make a great choice.
Absolutely. Perfect. Now, does a patient have to stay in the hospital after cataract surgery?
They don't, and that's really one of the great things about cataract surgery. So we have a surgery center here at Heaton Eye Associates, and it's a highly accredited surgery center. We have really a phenomenal staff. We also have a brand new surgery center in Longview that will be opening any day. Nice. And so we provide two opportunities, two locations in East Texas to provide surgery. And no, it is not a hospital stay afterwards. They come in, they spend really a fairly short amount of time in the surgery center. It's not a long surgery, and then they get to go home right afterwards. Within an hour, they're at home, resting comfortably and painless recovery for the patient. We have the staff with our highly trained nurses. We also have board-certified anesthesiologists, and so with a little IV sedation, patients can comfortably get through their surgery with the best anesthesia care. When the patient leaves then, there's no stitches in the eye, there's not a patch on the eye, and the patient gets to go home only needing to wear a shield over their eye for about the first week to protect it while they sleep.
Okay, and then after the first week, they're all healed and can see perfectly? In theory?
Great question. That's what we hope for. So the healing is really pretty easy. So it's often that when a patient goes home, they're going to be fairly blurry that day. The blur clears, and depending on the pre-existing eye conditions and the type of surgery that we do, some patients heal a little faster and get a little clearer quicker than other patients. But yeah, the healing, it just happens over a few days. By a day or two, patients driving, and they can even go back to work as long as it's not strenuous work in the first few days. But yeah, they're back in action within a day or so. We typically would do the second eye within a month after the first eye if a patient needs to have both cataracts removed. And so we work in a couple of follow-up visits at our clinic to follow them and to make sure that they're doing well and to help them along their course of recovery. The vision slowly gets better. They're going to continue to heal for months, really, where the vision can continue to refine. But to your question, yes, after about a week, the patient is really in great shape.
Okay, really, really good information. So if somebody thinks they have a cataract or just wants more information, where do they go?
So they can get on our website, heatoneye.com. You can find us on our Facebook page, and you can find out a lot of information that way. Or you can call and you can make an appointment with one of our optometrists who can give them more information and do some screening and do a good, thorough overall check of the patient's eye, determine whether or not they're a candidate for cataract surgery, and then with the surgeon where they get to speak with one of our cataract surgeons to do the things that we just talked about, to have some high-tech testing done and a great conversation with the surgeon to find out what they need and what they would benefit from after cataract surgery.
Perfect.
Yeah.
Really good information. Thanks so much. It's good to see you again, Dr. Nickel.
It's fun to talk about.
Thanks.